Let me know when you're good. David Crisafulli, Leader of the Opposition, Queensland, testing 1, 2, 3. Good to go?
Yeah.
We've just seen another 24 hours of chaos in the Queensland health crisis. And the scenes that we witnessed throughout the southeast yesterday shouldn't be part of a modern Queensland health system. How did we find out about it? A paramedic called the opposition. Now, if that doesn't tell you that alarm bells should be ringing for the government, I don't know what does. Patients are feeling as desperate and helpless as ever, and paramedics are at breaking point. Staff in the hospital just want nothing more than to be able to treat the people who turn up. And I can tell you the AMBOs want nothing more than just to get back on their shift, because at the end of a ramp is a frustrated ambulance officer, and at the end of the phone line is a Queenslander in desperate need of help in their hour of need. And both are at breaking point because of a government that won't listen to the solutions that have been put on place. Today we can show the full extent of what that is looking like at the coalface. The opposition can reveal statistics that show ambulance wait time, longest wait times across the state, and they are alarming. At some hospitals, up to 8 hours. So I want people to grasp the magnitude of that. Patients are waiting up to 8 hours at the end of an ambulance ramp. That's an entire shift for a crew off the road. On the Gold Coast, for the last 6 months, a patient has waited over 7 hours every month. Every month. The system is at breaking point, and the government must listen to the solutions. Before I hand back to you for questions, I just want to make a brief comment about the Auditor-General's scathing report into the way that this government conducts itself. He is right, and we support the calls from the Auditor-General to make sure that ministers and departments uphold their end of the bargain and table reports on time and in full. Because what we're seeing is the marrying of a Queensland health crisis and an integrity crisis, when in 3 of the last 4 years, the health department can't even meet its end of the bargain and release to Queenslanders the way the departments are running. On one occasion, the Auditor-General has found that the report was actually finished but wasn't tabled for several months. I can tell you why. Because it's all about political opportunism, and it's all about when can the government release something that best suits their agenda, often on a Friday afternoon. This government is more concerned with how things look than how they are, and the result you're seeing at the end of ambulance ramps across the state. Over to you for questions. I support ministerial accountability. So if the government feels that the only way that can occur is through legislation, we'll back it. But I can tell you what I would do as Premier. I'd hold ministers accountable. I'd hold ministers accountable for their actions, and if they have a deadline, they make them. And I would hold ministers accountable for their performance. And right now, this morning, there's another half a dozen AMBOs waiting at the end of a ramp, and I look forward to the Health Minister outlining her solutions. We've put ours on the table. Better triaging, better resources, sharing data in real time, and putting doctors and nurses back in charge. That's how we'd fix the Queensland health crisis. Now, there will be other ways, but I would love to see the government start listening. But when you hear the AMAQ say that we sit at round tables and the government nods and then nothing ever gets implemented, when you have a parliamentary report where 40 recommendations are made and only 10% of those relate to the state, I don't believe the government is serious about fixing the Queensland health crisis. I think they see it as managing a media issue. So today we'll either have one of the following. It'll either be an absolute disaster that they'll fix, or it'll be a complete case of denial. We might have a little bit of Canberra bashing thrown in. But in the end, what I would love to see is the ministers to say, I acknowledge that Queensland health is in crisis. These are the solutions that we are putting in place, and this is our reflection of what the opposition has said, and this is how we would do things, either to adopt those or put other things on the table. That is what a proper minister who cares and values the Queensland health system would do today. I look forward to the Health Minister's response. Better triaging, better resources, opening the data to drive that cultural change, and putting doctors and nurses back in charge. So if I concentrate on all four. So better resourcing means money, means ensuring that it's at the front line. It means that a chair sitting underneath the shower head can't be included as a bed. And that's what's happening at the moment in Queensland. Data means that in real time we should be able to see what the wait times are, what things are like on a ramp, as you can in other states. That's important. Better triaging means that when somebody arrives at the end of a ramp, there needs to be dedicated people to make sure that the frustration experiencing by our AMBOs isn't occurring, so that people get the right treatment that they need and they're not sitting in a state of abeyance. And finally, putting doctors and nurses back in charge. And I'm sorry, but what I have witnessed in the past half a decade is this government knows best controlling mentality, where everything gets centralised back to the administration HQ. And I'm not comfortable with that. I think the best person to fix the Queensland health crisis are the people at the coalface, and we should be trusting them to drive that cultural change.
Opposition Leader, you hear a lot about the amount of strain on the health system in terms of the close contact rules. I think it was maybe a week or two ago, I think it was about 3,000 or 4,000 health workers were off. Do you think that maybe it stems a little bit deeper than a crisis in terms of maybe they should start looking at that close contact and isolation rules around our medical facilities?
Sure, Peter, but COVID has been the added pressure to an already buckling health system. And I don't think it's fair that we can give the government a leave pass and say that it's because of COVID that Queensland Health is in crisis. Queensland Health has been in crisis for half a decade. And if you look at the figures that we talk about, they have continued to get worse. And I acknowledge that COVID has been an added pressure on the system, but the faults with Queensland Health were well and truly exposed before we even knew what COVID was. So I look at ambulance ramping as an example, which, let's be honest, is the crisis at the moment that needs to be addressed. When this government came to office, ambulance ramping was at 15%. Today, across the state, it's at 38%. But in most of our southeast hospitals, it's 50% or higher. At this one, 44%, and that is a 45%, and that's a 4% jump on the same quarter last year. So things have progressively continued to get worse. So do we back reviews in making sure we can maximise our workforce? Of course. Do we acknowledge that COVID has put pressure? Of course. But the Queensland health crisis runs far deeper than impacts of COVID, and the Minister must acknowledge it, must reflect on it, must work with other levels of government, but above all must accept responsibility and heal the wounds of the Queensland health crisis.
The stats that we've been released today, are they as current as COVID, or are they sort of probably?
Yeah, the stats we released today are at the last 6 months that are available to us, and in every one of those 6 months it shows the pressure of the system. Now, in the majority of those 6 months, it was before Christmas when the borders opened and we saw the spike in numbers. So no matter what array of figures you use over the last half a decade, it shows a decline in service. And that's not the fault of the doctors or the nurses or the AMBOs or the patients. It's the fault of a state government that is incapable of delivering essential services. And the more this government goes on, the more it becomes evident that they don't have the attention to detail to be able to deliver frontline services. And you only have to see the Premier's response at press conferences to know that she's not across her brief. Well, that matters. And it matters when you're trying to fix something as complicated as the health system. And I'm not suggesting the Health Minister doesn't want to try and fix the health system, but I doubt their capacity as a government to do so, because you have seen the progression of the health system getting worse.
Have you ever seen anything like the scenes you saw yesterday in terms of the ramping?
It was a 24 hours of madness, and to see the frustration of those paramedics, it's heartbreaking. But just know that right now, this morning, there's half a dozen AMBOs at the end of the ramp behind us. I just saw it with my own eyes. So yesterday was horrendous. When you talk about over 100 jobs being unable to be met at any one time, but it's not the first time that we've seen a system at breaking point, and it won't be the last. And until the government starts listening and enacting solutions, it's going to continue to be business as usual for Queensland Health, and Queenslanders aren't comfortable with that. them making the decisions. And the idea of the health and hospital systems were to have local people to be decision makers. And what we've seen is both financially and in terms of power and jurisdiction, that's been taken away from them. In the last budget, the health system, the reduction in the health system came from those HHSs. Now, that's troubling. I would have thought the government would say we are going to increase spending for the health and hospital networks because they're at the coalface and they're best placed to make those decisions. But it's not. They were all asked to make a cut. Every one of them were asked to provide a cut. 400 million over the funding window. Now that is absurd. So the government will talk about a record health spending year on year, and of course that should be the case. Governments should always increase health spending because it is the biggest issue of need in the community. But if you drill down, you actually see that that money is not getting to the coalface. And I think the best person in charge of fixing a health crisis are the people who every day have to go home at the end of a shift broken because they can see a system that's letting them down.
You know,
Thanks.
The unemployment rate?
Do you want the Italian one as well? Goodbye, mate. We're not going to have 6 weeks. What did Frydenberg get asked this morning?